pandemics with more frequency in the last 2 decades. We had SARS and MERS and every other kind of
Exactly.
issue that we faced. This would not be the last. And, I think this gives us an eye opener to prepare ourselves for the next challenge. I think unless we tackle the skew, tackle the issues around infrastructure, address the shortage of people that we have on the healthcare delivery, I think we would be caught short again. Hi, I'm Dilip Jose, Managing Director and CEO of Manipal Hospitals. I'm happy to be here and to be able to answer any questions that you might have.
Let me begin with asking you the last 24 and 25-month period for every one of us has been very difficult. So, how challenging were the previous 24, 25-month period ever since the onset of the pandemic?
Obviously, it's been extremely challenging. Like you said, Rohit, it's been a tough time for the whole country, for everybody. But for hospitals in particular, having had the necessity to be at the front end of the fight with the COVID, I think it's been especially challenging. If you look at the wave one, where very little was known about the disease and very little was known about the way to tackle the disease, it's been especially challenging. And wave one and two. And if you look at in the first wave, as hospitals and as healthcare workers, all we had was the PPE and the belief in ourselves, right? I think especially challenging. And furthermore, I think to keeping our people safe all through this first couple of waves in particular, before vaccine came, keeping our teams safe would have been especially a difficult issue for not only for Manipal Hospital, for all healthcare delivery groups. So that's been the significant challenge that I would want to highlight. Barring that, we were as impacted as the rest of the country were, that, in terms of as an enterprise or as a business operation, we were as impacted as most other sectors. But the additional challenge was about keeping our people safe and having had the front-end responsibility with very little knowledge, especially in the first wave.
Yeah. So, Dilip, you were at the helm of Manipal Hospitals when this first wave and second wave both were going on. So, how did you impact as a leader? How did you get impacted by this, and how important was it for you to guide the team of Manipal Hospitals during this time?
I think, like I mentioned earlier, that our teams were put in harm's way from wave one, right? Our doctors, our nurses, our front-end colleagues were in the harm's way from day one. So, as the leader of that team, I could not be away. I could not be working from home. So it had to be demonstrated on the ground that the leadership team is there in the front in whatever way we can, ensuring that our team's morale is up. They are supported in whatever manner that they required support. In many instances, people fell sick. We are a 20,000 strong organization. I think about 8,000 of us fell sick during the first three waves, one after another. We ensured that everybody were taken care in our own hospitals, irrespective of the position or the role that, from the junior most to the senior most persons were taken care by our own doctors in our own systems. So we had demonstrated on the ground that we stand with our teams in this hour of need. We also had several initiatives to ensure that the families back home of our friend and colleagues, especially the nurses, are reassured of their well-being. That that most of the nursing team members in many hospitals are youngsters who stay away from home, stay in hostels, and so most of them would not be from that place where they work. So I think giving comfort to their family members back home that their wards are well looked after, well taken care, I think that was important. A lot of the work for the leadership was around communication, that keep communicating, be visible, be there to provide any kind of support that is required. Logistically, of course, at the back end, it was about ensuring supplies, ensuring that nothing runs short in any of our hospitals. Those were the logistical challenge, but the front end was about keeping the morale up and keeping on communicating and provide visible leadership.
Right. My next question would be that moving forward, vaccinations were very important for the country. So, with over 189 crore vaccine doses administered so far, how would you rate India's vaccination drive?
Rohit, as the numbers suggest, it's been an outstanding effort that, you would recall the early skepticism that, at the rate of vaccination, we would take 5 years or 10 years to, double vaccinate. If you recall, those arithmetics were floating around in the early stages of vaccination. I think what we have achieved as a country is, very, very creditable. I think it's an occasion where, all sectors came together: center government, state government, the local administration, private and public hospitals, pharmaceuticals, and vaccine producers. I think it's been a collaborative effort. And, given the scale of our country in terms of number of people and the geographic area that needs to be covered, it's been an incredible effort, is what I would say.
Right. But Dilip, I would say that during this pandemic, a lot of gaps were also revealed in the healthcare system of our country. So, according to you, what does our healthcare system lack the most?
I think one thing that should bother all of us is a skew, Rohit, that, a significant chunk of our infrastructure, in terms of hospital beds of good quality, and our talent, doctors and nurses, are concentrated in a small area that, maybe in a handful of towns and cities. There are large swathes of the country that, which is underserved. So you could see, when you look around the country, when you look at the presence of even the primary care centers or the concentration of doctors, there are significantly underserved areas. I think that is one significant aspect that I would want to highlight, that the geographical skew of our infrastructure and talent is a big concern. That is something which COVID really threw up. There were parts of the country which coped with it better than other parts of the country. It's a reflection of the infrastructure on the ground.
Right. So how can we bridge this gap as a country, you think?
I think it has to be a concentrated or a focused attempt to sort of address the skew, that, focus on underserved areas to see what is that we can do to build infrastructure. But then, keeping in mind, building infrastructure is only one part of the challenge. Finding people to staff them, finding doctors and nurses and paramedics to work in those places would be the challenge. I think it's much easier said than done. That, it would not be a short-term journey. I think we would need to plan, incentivize, motivate people to create infrastructure, whether private or public, to address the skew, and then motivate the healthcare workers to go and work there, to go and function in those areas. I think that's a challenge. I don't think we would do well if we take it tightly. I think it is not only a matter of investment of finding money. I think it's a matter of the will and motivation to really tackle it. Otherwise, COVID is one pandemic. If you notice, we've been having pandemics with more frequency in the last 2 decades. We had SARS and MERS and every other kind of issue that we faced. This would not be the last. And, I think this gives us an eye-opener to prepare ourselves for the next challenge. I think unless we tackle the skew, tackle the issues around infrastructure, address the shortage of people that we have on the healthcare delivery, I think we would be caught short again. I think we have maybe some years to really address it.
Right. Do you think that the sunrise sector of healthcare, new startups that are coming up in the country, they can help in mitigating some part of it, maybe?
Maybe some part, technology certainly helps bridge, some sort of a gap, which is around the access that, telemedicine, for example, would sort of bridge the issue around access that, the talent skew that I talked about in part could get addressed with telemedicine. But for that to work, India also needs to go through a cultural change that, Indians still want physical access to a doctor,
That's correct.
a healthcare worker actually touching and feeling and probing is what, people consider a consultation.
Yes.
So I think it has to be a combined effort that, a cultural change, a mindset change, along with technology is what would address. But certainly, like you said, it would fill a gap, but it would not fill everything. It's certainly one way of addressing the gap that we talked about, but we can't just depend only on one of these action items to tackle or deal with the issue that we have at hand.
All right, all right. So, as you said about our countrymen generally requiring some sort of physical consultation to consider a consultation as a consultation, that has to maybe perhaps change. Do you think with the healthcare startups coming up and providing telemedicine and things like that?
See, like I said, Rohit, that is one of the elements. But one thing we should be clear that, for a country like India, with its scale and with its number of people and with its mobility pattern and with the strained economic resources that we have, tertiary care is never going to be the solution for our healthcare requirement. I think the answer lies in primary and preventive care, in promotive care, and preventing a disease from escalating to a tertiary quaternary situation, which is going to be expensive, particularly in the absence of adequate insurance or other kind of safety nets. So I think our solution lies in prevention, promotive care, and also when we look at healthcare, we would need to look at this as an ecosystem. That we can't talk about healthcare without safe drinking water, without sanitation, without primary education. There's no healthcare without women's empowerment. So we can't just look at this percentage of GDP is healthcare. We would need an ecosystem approach, and particularly given our size of the population, our mobility profile, our aging demographics, I think that's the way to look at. Tech, of course, is one element, but unless we address the challenges of the ecosystem, look at it holistically, I don't think we will meet the goals that we have to meet.
So tech can be an enabler, according to you, moving forward. Yes.
Yeah.
Okay. So moving forward, I think specialty healthcare is something that Manipal Hospitals excels at. So do you think, as a country, we need more investments to help push towards specialized medicine and specialty healthcare?
Certainly, but I would refer back to what I mentioned just a minute ago, that our country's solution is not going to lie in specialty care. That it would have to be prevention and promotion, promotive care, preventive care. But even then, even with the best attempts in that, given our 1.4 billion patients, 1.4 billion population, there would be patients who would end up requiring specialty care. So however much you would try to prevent a disease or sort of treat it at an early stage, there would still be spillover to a tertiary quaternary care level, and that would require specialized beds and specialized enterprises, specialized facilities like Manipal. So that investment is certainly required. But I would say, I would only augment what I said earlier, that we would need to look at healthcare as an ecosystem, plus need to plan for these spillovers into tertiary and quaternary care by creating infrastructure and addressing the geographical skew in that.
Okay. So considering that we are getting past, it would be too early to actually say that we are past the COVID-19 pandemic. But how are the non-COVID-19 footfalls in the Manipal hospitals in 2020?
They're coming back. They're certainly coming back, Rohit. I think we do have currently we in the last couple of months we hardly have any COVID patients in the system, admitted patients in the system. So I think non-COVID is really coming back, particularly the elective work, particularly the kind of cases where people are postponed to a later date, like joint replacements or elective kind of surgeries, and so they are coming back. But one challenge or one concern that we have is the disease progression. The fear of going to a hospital during COVID in the last 2 years. I think that has resulted in many patients ending up in a situation where their diseases have progressed to a stage where whether the treatment is maybe impossible or treatment is going to be costly. I think that is a sad side effect of, if one can use the word, of the COVID situation. That where people were fearful of going out, worrying about catching the infection. I think in many cases people have ignored their health conditions, and some of them have now progressed to a situation where tackling the concern is going to be difficult or expensive or both.
All right. So, coming back to Manipal Hospitals and its plan for the 2022 year. So, what does Manipal Hospitals plan to achieve in the next 2 years, would you say?
In terms of infrastructure, in terms of expansion, we are in the middle of commissioning a new hospital in Pune, a quaternary care center, 250-bedded quaternary care center, which would come up in June. We are also building 2 greenfield hospitals in Bangalore. So, and we also have expansions happening in some of our existing facilities. So that is in terms of infrastructure. I think the plan is really to get back to what we do best, that is caring for our patients, to ensure that everybody who would want to access Manipal are able to do so. That is the priority, and to get back to what we do best, like I said, caring for our patients. That's the way we would want to look at. Infrastructure is just a enabler to do that. So we would want to look at our growth in terms of the number of patients that we are able to help.
Okay, Dilip, what about your presence in the northern part of India? Nepal is many times seen as something that has focused its large part of its hospital chain focused on southern part of India.
We do have 5 hospitals in north. We have a large quaternary care center in Delhi, in Dwarka. We have a hospital in Gurgaon, one in Ghaziabad, one in Patiala, and one in Jaipur. So these are the 5 hospitals we have there up north. Obviously, we would need to expand the presence further. Today, we have 27 hospitals. Like I said, the 28th one in Pune is getting commissioned. And if I say out of this 28, the 5 are the ones in north. Obviously, it means that we will have to do more there. We are on the lookout. We would want to expand our presence in the National Capital Region by at least 2 more facilities. We will look at that. We have only one hospital in the east at the moment, one hospital in Kolkata. That's again is a geography that we would look to be more robustly present. So these are opportunities that we would like to explore. South, like you said, we have a far stronger presence, and the plan is that we would our presence would be more even. So we would look at expansion to these other geographies that you alluded to.
Right. So rest of the country expansion is coming soon for Manipal Hospitals.
Hopefully, we are open to considering options. Whether it's greenfield or brownfield, we would be on the lookout, and we would take them forward as and when they materialize.
Right. So I would like to conclude this interview by asking you about your reading on the COVID-19 situation in the country presently. Do you think we should be worried with the spike of the number of cases recently?
Yes and no, in the sense we should not be unduly alarmed, but these spikes are expected. When a pandemic of this kind sort of wanes off, but then we should be worried if people become less cautious. I think it is not the time to give up mask. It's not the time to give up social distancing. I think people should not get into a mindset saying that COVID is behind us. That there is still a lot not known about this virus. What can happen, in what form it can come back, what mutants are still possible. I think we do have the benefit of a significantly vaccinated population. That gives us some comfort, but we should not give up the preventive measures about social distancing, hand sanitization or personal hygiene and masking for sure. I think that's the way I would look at it.
Okay, those were some great answers, Dilip. Thank you for taking some time out to do this interview with the Business Outreach magazine. We wish Manipal Hospitals good luck for the rest of the year.
Thank you, Rohit, and thank you for asking me to join you. All the best to you too.
Thank you.